I'm Joe Schacht. I run a lab that studies treatment for alcohol and substance use disorders. I've been working on GLP-1s for about 3 years now, and these drugs have been miraculous. Ozempic is one of them. Now the dual agonist GLP-1, GIP drugs have really transformed the way that we think about obesity and weight loss. And in particular, I think it's helped so many people understand that these are not diseases of willpower. These are biological diseases that are deeply rooted in the body and in particular in the brain. But what is also increasingly apparent is that these medications are not limited in their effects to only metabolism or body weight. They have widespread effects across the rest of the body. And in particular for someone in psychiatry like me, they have effects on the brain. Now, as someone who studies addiction, as soon as I heard that these drugs could do that, I became intrigued because this is the fundamental mechanism of addictive disease, the uncontrollable, insatiable craving to drink or to use a drug. Alcoholism, or alcohol use disorder as we call it medically, is the third leading cause of preventable death in the United States. It accounts for 10% of all deaths among working age adults. Now, interestingly, alcohol use disorder and obesity share many different features. These fundamentally are diseases of impulse control. And this leads to, I think, a natural question. Could this transformative class of obesity drugs, GLP-1 agonists, also be efficacious for treating alcohol use disorder? This led, of course, to clinical trials for these medications. This is the first one of semaglutide for alcohol use disorder, and it showed that semaglutide, relative to a placebo, reduced alcohol craving and consumption. In particular, it reduced something that we in alcohol research call a heavy drinking day, but the patients in this trial were lower severity. And so we did our own trial of semaglutide here at the University of Colorado. And now I can show you what our data actually show, which is that in a very high severity group of people with alcohol use disorder, we're drinking very heavily, that semaglutide, relative to placebo, reduces alcohol craving and it reduces heavy drinking days. And this is really an incredible amount of hope in this field for a new class of medications that will ultimately help people control their alcohol consumption.